All right, Mike Vicaire at the White House. Thank you, Mike.
Certainly.
So for more reaction, I'm joined now live by Democratic Congressman Elijah Cummings of Maryland, a member of the House Task Force on Health Care Reform. And a good morning to you, sir.
Good morning.
Let's get to the stuff that happened yesterday prior to that vote. I'd love to know what went on the floor, behind the closed doors, to ensure that the Democrats would have the necessary votes.
Well, we had folks who were concerned about public money being spent for abortions, and we had to come to some type of resolution with them, and so we allowed the amendment came forth, and they won that amendment, and that was very crucial. With regard to our Hispanic colleagues, they had some concerns too, and we were able to resolve those. So, but it was a major victory for the president and for our leadership team, Speaker Pelosi, Clyburn, and certainly our whip, and Steny Hoyer, our leader. So we feel real good about it. But we can't rest on our laurels. We're going to be pressing very, very hard on the Senate to get this vote, get this matter to do whatever they have to do with regard to legislation, bring closure, and then vote up or down. The American people deserve that.
Regarding that steep-back abortion amendment to the bill, which certainly did pass, some are suggesting it might not make it to the final bill. Here's Republican John Boehner last night and what he had to say about it. Let's listen.
And in conference, do I have your guarantee that your vote will be in favor of the stoop-back language?
Well, I haven't normally cut any deals with you as a Republican, but why don't you talk to someone on your level in the House leadership, as you have in the past?
My time, Mr. Speaker. This is exactly
so rude. Why don't you be so rude? You asked me a question.
And the
gentleman reclaims his time.
Shame on you.
It's exactly the point I've been trying to make.
Will this amendment survive? And if it does not, won't that anger some moderate Democrats?
I think it, I don't know whether it'll survive or not. I think there's a 50-50 shot. But I want you to understand that the whole issue of abortion is one that's very sensitive, and basically I think each side, the pro-life and the pro-abortion side, pro-choice side, basically have a true respect for one another. And so I think that we don't know how this is going to come out, but I can tell you one thing. I think that no matter what, the legislation will pass. As the president said to us when he came before the Congress a month or so ago, he said, do not let the perfect be the enemy of the good. Believe me, I have not seen one piece of legislation in all my years in public life that I liked everything about it. And so we've got to keep in mind, though, that we've got a person dying in this country every 12 minutes because they don't have insurance. And we've got to remember that there are people looking at us right now, that cannot figure out how they are going to get well. I mean, they're sick, and so we've got to address that. And there are a lot of folks that have pre-existing conditions, and even if they had $100,000 to spend for insurance in a year, they could not even get a policy. So this is what this is all about. We can do better. This is the United States of America. We can do much better, and we're going to do that. And this was a great victory. But keep in mind, this is only the beginning. We have got to have a full court press on the Senate. They have got to bring this matter to a vote up or down. I think the American people deserve that. It
is a vote that Steny Hoyer claimed as being bipartisan because of the actions of one lone Louisiana Republican, Representative Joseph Gow, who crossed the line. At what point did you know? Were there rumblings that this was going to happen, or was it surprise? Because that vote went down after the Democrats had secured the 218 to victory.
With regard to the Representative Gow's vote? We had heard rumors that he was going to vote with us. We also know that there were some conversations with the president, and the president was quite persuasive in many, many ways. And so it did not shock me, but no, I did not know it until it happened.
Okay. If you look at what lies ahead in terms of the calendar year, November 8th, and we've got the holidays ahead, do you envision a scenario in which the Senate will put forth their bill, that this will all be reconciled and it'll get on the president's desk for signature before the end of this calendar year?
I believe with all my heart it will be get done before the end of the year. I think the Senate understands that, you know, the House moved on this in a way that was quite deliberate, but it was done rather fast. And now it's up to the Senate to take the momentum that the House has brought about to push it further. But the more important thing is that they've got to keep in mind that there's an urgent need for this legislation. There are too many people in our country who are suffering, and we can do better. Again, they can get it done. They need to sit down, talk to each other, work this thing out, so that we can then get into conference and see if we can come up with a decent piece of legislation to send to the president. And I believe with all my heart that we'll do that. But the American people, by the way, play a major role in this. They need to get on the phone and call their senators and say, look, we want an up or down vote on this legislation so that we can have the security and have the things that we need to be able to have good health in our country.
All right, Maryland Democratic Congressman Elijah Cummings, thank you so much.
Thank you.
For more on this